Hey folks, my name is Derek Fisher, and today I want to talk to you a little bit about healthcare IT. Now, I've been in engineering for roughly 30 years, spent a lot of time in hardware, then software, and then into cybersecurity. And my initial start in cybersecurity was actually working at a healthcare company. Healthcare has a lot of unique challenges, and so I'm really interested in jumping into this topic. I teach at Temple University here in the Philadelphia area. I've written a book on application security called the Application Security Program Handbook. I've also written a series on on cybersecurity for children, which is available on Amazon if you want to take a look at that as well. Been on a lot of podcasts, do a lot of writing. I would highly recommend you look me up on LinkedIn, and hopefully you enjoy the content that I create and you'd be open to connecting with me. Always looking for new connections. So with that, looking forward to jumping in this topic of security in the healthcare IT space, and I hope you're ready to take it all in. So with that, let's jump right into it. All right, so let's go ahead and dive into the whole concept of healthcare security. So when you think about a hospital, and I'm going to do my best here to draw a hospital building so that we're all on the same page. There's a hospital. Okay? And within that hospital, you think about all the different systems and applications that are there to support the operations of the hospital. So first of all, you have the medical records, or the the electronic health records system. So you have an EHR, which basically is used for collecting and managing all the health records that individuals, patients, as they come in and see the doctors and get any kind of service done, whether it's imaging or labs and things of that nature, they all go into that health record. You also have clinical applications. You have pharmaceutical, scheduling, and all of these, again, are different components of that hospital system. And each one of them supports a different department or a different part of the operation of that hospital. And a lot of these other types of applications feed into that electronic health record application as well. You also have a lot of machines within the hospital. So think about the MRI machine, the X-ray, the CT scan. And likewise, you have a lot of other pieces of hardware all around the hospital to support patient care. So you may have what they're called code carts. You might see a lot of equipment on carts in a hospital, and they may have things there to be able to hook up to a patient to do quick diagnostic on a patient. And those are just basically floating around the hospital in different areas. You have a lot of IoT devices as well. So not just in the hospital itself, but you have patients going home with medical devices. Some of those may actually be implanted in the individual. So think of whether it's a pacemaker, or maybe some type of insulin pump, or other types of devices, even the smart devices that we wear on a daily basis, things like smartwatches that collect a lot of biometric information and by nature medical information. All that gets collected and can be used in an EHR system. So that data that can be collected, you may present that to your doctor when you go see them, and they may put that also into the medical record. So all of this means that there is a lot of data. floating around in these systems. And it's important to understand the magnitude of the amount of data that's collected here. And the reason why this is important is the fact that if you think about some of the data that is sold on the dark web, for instance, let's say a social security number. If you want to take a guess on how much a social security number is worth online, you'll probably be maybe wrong, but it's roughly about $1 to $5 online on the dark web. And the reason for that is that a social security number, it's a sort of a supply and demand thing where everyone's social security number is available on the dark web, whether you like it or not. That number alone, it's not as valuable as maybe it was a long time ago before we had other means of verification. But nonetheless, social security numbers do exist on the dark web, and they are worth a couple dollars each. So moving on to something like a credit card number, where that could run anywhere from $5 to probably about $30 online. And the reason for that is that there's a little bit longer window of opportunity for an attacker to use that, because they may be able to use that to purchase items before you know that your credit card's been stolen. You call the bank then cancels your card. The card is no longer valid, but there is a window of opportunity there for an attacker to use that credit card number to their desire. Then we have another item called fools. And fools is basically a complete set of data about an individual. And so this can be used to commit identity theft or other types of fraud related to a given identity. And these can actually run around $300 on the dark web. So we're getting somewhere a little bit. But if you think about the medical record and everything that's included in it, they actually run close to or roughly $1,000. And the reason for that is because there's a lot of information in that medical record. So there's very specific information about the patient. There may be financial information in there related to making payments to the hospital or to the doctor's office. That could be using insurance, that could be using credit card, maybe even a bank, linking to a bank account and so forth. Also within that medical record is a lot of information that comes from a lot of these tools that are collecting data by medical data about an individual. So you may have received a test result from your doctor or from the hospital that is, less than flattering. Maybe you want to keep something obviously private. You don't want everybody to know about a diagnosis that you may have had. And that information is now in that medical record and potentially in the hands of cyber criminals. And so that medical record, once it's stolen, can be used to commit a lot of different types of activities by the bad actor. So they can commit insurance fraud. If they have your insurance information, they could potentially blackmail you based on information that is in that medical record that you don't necessarily want released. And this has happened to some individuals. And you may have financial information there, your credit card, your bank account linked in there. There's a lot of information that can also be used for more targeted phishing types of attacks. So an attacker wants to target you specifically to try to get information or try to get you to click on a link in an email. They can make it look like it came from a recent interaction that you had with the doctor or the hospital, because now they know the places that you've been, the diagnosis that you've had, and so forth. So that medical record actually has a very large wealth of information in it that an attacker would love to get their hands on. So why does this happen, and why is it a big deal in the healthcare space? Well, one of the biggest problems in the healthcare space is money. And the reason why is because the purpose of a hospital is to provide care. I'm going to do my best at drawing a little patient here laying in bed. The purpose of a hospital is to provide care to that patient. And they're not in the business of ensuring that their IT systems are up and running, that their IT systems are have the latest features and all that stuff, because that's not a doctor's goal. If you go and talk to a physician or a nurse or anybody that works in a hospital and say, hey, do you know anything about the operating system that your electronic medical record application is running on? They don't know, and they don't care, because all they care about is, can I get the data, the information that is in that medical record in order for me to provide patient outcomes. And so a lot of the funding that goes to hospitals and healthcare systems is in service of ensuring that there's good patient outcomes. And that's what we want. Our expectation is that when we go to the hospital or we go to the doctors, that they are going to provide us care, not tell us how to reboot a server in a data center. That's not their role. So there is a bit of an issue in terms of funding, in the sense that a lot of funding does not go into ensuring that the technology is where it would be in like a organization that their primary function is technology. But furthermore, that means that security, as we know, those of us who work in a security space know, that security is often a sliver of the IT budget, which means that security is getting a smaller cut of that IT budget. So another thing that becomes a bit of a challenge with securing the healthcare space is a lack of well-trained IT staff and well-trained individuals that work inside the healthcare system. And what I mean by that is that a lot of as I mentioned, the doctors, the nurses, the assistants, and everybody that works in a healthcare facility, they are often not technically inclined. And not only that, but they're in a position where they need to respond to things rapidly and quickly, and attackers know that. They know that there is a sense of urgency in a healthcare system, and they take advantage of that. So for those of us that are familiar with social engineering attacks, bad actors, when they're performing a social engineering attack, they are trying to get you to think, to not think and actually react quickly. And so this system is set up for that type of environment where there's a lot of documents being sent to and from different systems. A lot of the users of those systems are trained to open up those documents or click on links. And so, couple that with a sense of urgency, you have a bit of a perfect storm for malicious actors to be able to perpetrate social engineering attacks. And the other issue too is that oftentimes, because of the budget constraints, there are not a lot of IT staff within the hospital system. And a lot of those IT staff, especially the security individuals, are often pulled away from these less ideal situations for security individuals to work in, and instead pursue opportunities in places that are more likely to pay higher, better hours, more flexibility, and so forth. The other issue related to securing this system and the challenges in this system is the aversion to downtime. And so you can think about, if you show up to the hospital, to the emergency room, and they turn you away and say, sorry, but we're in the middle of our weekly patching cycle and we're going to be down for an hour or longer, that's going to be a problem. And with healthcare IT systems, it's very difficult to predict when that downtime is going to be. So for instance, in most organizations, most technology organizations, we kind of know that these are where the slow periods are in our operations in which to be able to do patching. There's also a lot of redundancy built into the system, so that allows us to be able to patch systems on a rolling basis. But in a healthcare IT type of environment, that's not as well defined and not easily done. The other issue is really connectivity. So in the cases of a lot of the systems that are in these healthcare environments, if you think about a MRI machine, and I'm going to butcher a drawing here of an MRI machine, but just bear with me. So this is a little individual going inside of an MRI machine. So if you think of an MRI machine, there's most likely an operating system and some type of interface to that operating system. And the interface could be another application. It could be a USB port where somebody can walk up and put that USB drive in there and update the software. But long story short is that the MRI machine, oftentimes the operating system is proprietary, the interface is proprietary, and because these machines are often built for a 10-year life cycle, this machine could be 10 years or older, depending on the situation. It may not have internet connectivity. The operating system may not be Linux, it may not be Windows, it may be something else, or it could be Windows and it could be an extremely old version of Windows. And so this creates challenges in the sense that you're dealing with potentially either legacy software or software that's just not connected to a network, meaning that somebody, this short-staffed IT individual, has to walk up to that machine, plug in a USB, work with the interface, and update the system. There's also a lot of other ancillary parts to this MRI machine. So there's going to be a viewing app. Sorry about that. A way to view the drawings. There's going to be some analysis software, and so there's going to be software that the technician is going to be able to look at and interact with the MRI machine. And what that means is that this becomes a more complex and complicated system where a patch to the operating system or to the machine itself may have ripple effects with some of the other parts of the system, making them unavailable. So you start to see that there is a bit of a challenging environment when it comes down to patching these healthcare systems in general. All right, so let's talk about some of the attacks that are related to this healthcare system. So as I mentioned before, in the medical record, there's a lot of information, which means that information can be utilized to perpetrate phishing attacks. And if you're not familiar, phishing attacks are essentially a bad actor sending an email to an individual, getting them to click on a link or something like that. And because there's a lot of information in here that can be used to better tailor a phishing email, these have a higher rate of success against not just patients, but also individuals that work within the healthcare space. The other challenge that we have here is the supply chain. And because there's a sort of a complex environment here, as I mentioned, you have these MRI machines or other devices that are in the hospital environment that have a lot of different connectivity into the overall system. These view and analysis applications are likely tied into the electronic medical record system, maybe the clinical system, and so forth. So there's a lot of different ways that these systems are all pieced together, but that creates, each one of these are created by different vendors, and that creates an opportunity, a very large attack surface for these hospitals, where the compromise of one of these components can lead to a broader compromise within the healthcare system. And the last thing, and probably the most well-known, is ransomware. And if you're not familiar with ransomware, which I'm sure if you're paying attention to the cybersecurity space, you probably do know. But so ransomware is bad actors being able to encrypt data within a system. And so, again, if you're not familiar, maybe that doesn't sound terrible. However, it is extremely terrible, especially in a healthcare environment where there have been plenty of cases where hospitals have been taken offline because of a ransomware attack. So if you think about it, if you have all these different systems and they're all tied into one or several databases, if those databases become encrypted and otherwise unavailable, then that means that these systems themselves are unavailable. So there have been stories of people showing up to a emergency room where they were under active ransomware attack and had to be turned away to go somewhere else. And one thing I do want to kind of take an opportunity to point out here is that in security, we talk about the CIA. And CIA stands for confidentiality, integrity, and availability. One of the biggest concerns that we have in the healthcare space is availability. And the reason for that is what I just stated, where if the emergency room is not able to handle patients coming in, that's clearly going to be a bad day for that hospital. Not that they're not concerned about confidentiality or integrity, but availability in this type of environment is paramount. All right, so now let's talk a little bit about vulnerability management. So the first thing I want to do is talk a little bit about vulnerability management in general. And the first thing is to discover your assets. So you want to identify what are the different assets that I have in my organization, in my network. So the assets could be your data, the systems that are part of that, or the machines that are part of that system, and so forth. You want to understand, what do I have? And also during this discovery phase, you want to know what's the criticality and what is the risk of everything that I have. So not all your data is going to be confidential, highly confidential information or not PII. And so therefore you may not have a high level classification for that particular set of data, but you may have stuff that is critical to the organization and stuff that you need to have a higher level of protection for. The next thing you want to do is assess. And what this means is basically I'm going to scan my environment and scan everything that I've discovered in the first step and uncover any kind of vulnerabilities that I may have in that anything that I've discovered. So my assets, I want to understand what are the vulnerabilities that are associated with the assets that I have. And those scans can be done through automated scanning, penetration testing, threat modeling, and so forth. But the whole goal there is to identify what are the things that can go wrong or that have been identified as potential vulnerabilities with the assets that I've discovered. You then want to report out on that. Make sure that that information that you found, the vulnerabilities that you found in your assets, get to the right people so that you can move to the next phase, which is basically remediate. So you've reported on what's been found, the issues through your scans of the assets that you have. You've reported that to the individuals. That could be your third parties. If it's your own stuff and you're responsible for patching it, you may have to report that to your IT team or the security team, and then they're going to go and fix it. So that could be your third party, your internal team, and so forth. They're going to go and fix those issues and make sure that everything is has been resolved. Then you're going to verify. Did the remediation work? Am I no longer vulnerable? And the way that you're going to do that is rerun your scans or rerun whatever assessment that you've done to verify, hey, did the what we reported actually get fixed? If so, then great. But this entire phase will continue to operate in this vulnerability management workflow. Now, again, this is more of a general type of vulnerability management. Discovery is always going to happen. You always want to make sure that you know what's in your environment. You want to scan it, make sure that you know what vulnerabilities are there. You want to report it to the people that need to know about it. They need to fix it. You need to verify that it's been done. And so this is basically a general vulnerability management workflow. How this looks different in the healthcare environment is some of the things that we've talked about. You have a shorter staff of individuals, but you may need to try to schedule downtime to try to resolve those issues in that fixed stage. Because you have a smaller set of IT individuals, and they need to be able to actually, in some cases, walk up to a device. Again, here's our little MRI machine with a USB drive and update that machine. And so that needs to be scheduled and ensure that the IT individual has the right skill set to be able to bring that down, patch it, bring it back up online, and test to make sure that there's been no other ripple effects to the other systems that are out there. And in some cases, these systems can't be automatically patched. And not only that, but they may not always be able to be restarted automatically and may require a manual restart. Which again is a bit of a challenge for the IT individual that needs to work with the complicated schedule, working with a system that they may actually have to walk up to. There's no auto restart. They may have to stand there and wait until the patch is done and then manually restart the machine, test to make sure that everything is still working. So although you're still doing the basic vulnerability management in terms of knowing what your assets are, what needs to be patched, knowing how to scan or get alerts from possibly your vendors that will tell you like, hey, we have a vulnerability that we've identified in a particular system that you're using, and then being able to get that information to the IT individual so that they can go fix it and verify and test and make sure that the patch actually worked.
All right, so we talked a little bit about the different challenges that exist within a healthcare IT system and why it's difficult for hospitals in particular to be able to patch the systems that they have. And so, with that in mind, there is help from the government. There is a program that is being initiated, just announced in May of 2024 from ARPA-H. And ARPA-H announced what they're calling upgrade, so Universal Patching and Remediation for Autonomous Defense, or upgrade. And according to the announcement, more than $50 million will be invested in developing tools designed to protect hospital operations, secure medical devices, and ensure the continuity of patient care. Now, the important thing to point out here is that the goal of upgrade is not to create a tool. It's really about investing money into being able to autonomously patch systems within the healthcare space. So that may be several tools, processes, people, and so forth. So what's in Upgrade? Well, the objectives for Upgrade are to proactively identify and assess vulnerabilities within digital hospital environments to enhance security, automatically develop and rigorously test remediation strategies to address identified vulnerabilities, deploy necessary patches effectively, ensuring minimal disruption to the functionality of hospital devices and patient care operations. In order to do this, achieving Upgrade's vision requires leveraging the expertise of hospital IT professionals to understand and address the unique cybersecurity needs of healthcare settings, collaborating closely with medical device manufacturers and vendors to ensure compatibility and security of medical equipment, involving healthcare providers to align cybersecurity measures with clinical workflows and patient care priorities, engaging human factors engineers to design user-friendly security solutions that integrate seamlessly into existing systems. Lastly, drawing on the knowledge of cybersecurity experts to develop robust, scalable, and effective security protocols. So with Upgrade, the promise to the healthcare industry is a vulnerability mitigation platform. And this will be accomplished by developing a software suite for hospital cyber resilience to proactively identify and remediate vulnerabilities, as well as creating what's called digital twins. And if you're not familiar with digital twins, it's essentially being able to, as the term sounds, create a digital twin of whether it's an individual, a system, a piece of hardware, software, and so forth. So creating these digital replicas will simulate and test security updates, ensuring minimal disruption to operations, one of the goals of healthcare IT. Next, rapid vulnerability detection by implementing methods to quickly detect software vulnerabilities and develop effective defenses. And then an automated patch deployment. So this will be accomplished through enabling automatic deployment of patches, reducing the time from detection to deployment from weeks or months down to days. So bringing this all home here, we talked about the different challenges that we have in the healthcare IT space, specifically around security. We have things like legacy systems, we have budget constraints, we have lack of IT staff specifically in the cybersecurity area. We have complex IT environments, we have an intolerance to downtime, and a host of different third-party dependencies. So the way we tackle these challenges is really by proactively managing vulnerabilities. And we can do this through the upgrade program, as I mentioned, as well as ensuring that we have systems that are upgradable, preferably over a network. We also want to make sure that we're investing in cybersecurity, not just with staff, but as well with systems that can effectively manage vulnerabilities within the healthcare IT space. This will include things like automation and efficiency in terms of being able to remediate vulnerabilities as quickly as possible. And then collaboration and expertise across not just the healthcare IT space, but the cybersecurity space as well to ensure that hospitals are staying up to date with the landscape in cybersecurity and being able to tackle those challenges as they come up. And then lastly, ensuring that we have continuous monitoring and training. So we want to regularly monitor systems as well as conduct staff training to maintain a strong security posture. And this will help reduce threat actors from getting into the systems in the first place. And with that, I appreciate your time and I hope you enjoyed this discussion. Thank you.